Shift one. We must move care away from hospitals and closer to the community. The NHS must become a neighbourhood health service. Shift two. We must move from a mindset that views health as all about sickness to one where we put prevention first, right across society. So we'll take bold action where early intervention can make a huge difference on mental health. And make no mistake, we intend to revolutionise mental health treatment in this country. 8,500 new mental health professionals, specialist access in every school, guaranteed treatment inside 4 weeks for anyone who needs it. And look, the mission we're launching today isn't just an NHS mission, it's a health mission. When we talk about a new deal for working people on employment rights, about good work for all, that's a health policy. When we say we'll provide breakfast clubs with healthy food for all primary school children, that's a health policy. When we commit to restoring a decent home standard, to regulating the water industry, to a new Clean Air Act, they're all health policies. And when I say we will take on the social media companies who push dangerous misogyny on our children, I am saying very clearly to those who profit from harming our children, no, not in Britain. And today we go further on that. We will change advertising rules, and we will make sure that products which are harmful to our children's health, vaping, junk food, sugary snacks, cannot be advertised to our children. No, not in Britain. Shift three, technology. A revolution that will accelerate the first 2 shifts and herald a different kind of healthcare. A move from an analogue to a digital NHS, a tomorrow service, not just a today service. And mark my words, this can be transformational. The route to the NHS offering shorter waiting times, better treatment, early diagnosis and meaningful prevention. Britain leads the world in science and technology. We can make this happen. This is the game changer, the light at the end of the tunnel. This is what will make the NHS fit for the future. I'll give an example. 33 million people downloaded the NHS app during the pandemic, and it's a good app. But that extraordinary opportunity, it's been wasted. Labour would take the app and innovations like it. We would deepen them, expand them, and put them in the hands of patients, and use them to transform our relationship with the NHS. Get this right, and it means moving to a fully digital patient records. Never again handwritten notes getting lost. It means booked appointments, appropriate self-referral routes, reminders to get checkups and screening, the latest guidance on treatment, patients in control of their own data, choosing how it's used and how it's shared. This will get rid of a divide between those confident to speak up for themselves and those who can't. And look, if we make sure everyone is supported, then we can take people on this journey, and it will mean people can get better choices, will get faster care, can manage their own health. In truth, it's about politicians catching up with the public and the NHS catching up with the revolution that's already happened in the rest of our lives. And it doesn't stop there. Technology provides more choice and power for patients, but it also saves lives. Take artificial intelligence. AI will change the nature of healthcare, and Britain is good at AI. I'll give an example. Lung cancer is the #1 cause of cancer-related deaths in the UK. 274,000 patients waiting for 11 days or more to hear back from the scan, which could tell them if they have cancer. AI can reduce workload and raise productivity. But here's the real thing. When used properly by a radiologist, it can reduce missed lung cancer diagnosis by 60%. And because it's quicker, because it's more accurate, the lives it could save through early diagnosis are countless. But to make this happen, innovators need one route into the NHS, not many, incentives to innovate throughout the system, fewer barriers to adoption, fewer hurdles to clear, less bureaucracy, more clinical trials, and a government that uses its full power to back our world-leading life sciences.